Hi, thanks for coming to discuss our sweet Angie, your sweet little fourth grader. Um, our 10-year-old girl has taken quite a few formal assessments to make sure we understand exactly where she's at. Let's get started. She took the Kaufman battery. This is a test that's designed for people ages 3 to 18, and it measures the processing and thinking skills of people in this age range. So our girl received scores that were in the low average range as well as in the um, borderline range. So that tells us that she's remembering what she's learning and that she's also um, able to learn more, and it's sinking in and staying. And for that, we're grateful because it's going to help her to further some other gap areas that we know that she has. Um, let's see, the next test that she took was called the Kaufman Assessment of Educational Achievement. That's a mouthful. And she scored low in quite a few of these areas and in borderline. I'm concerned about her letter and word recognition. That's borderline. Her math concepts were impaired, and that's of significant note. And so, with that, her computation was a little bit higher, but still at the borderline level. Her written expression identified as profound, which means we've got a lot of work to do. We've got to keep her practicing her writing. We have to do one sentence at a time. We might have to do a few words at a time, but we need to keep building that skill set this school year. Additionally, she has a good listening comprehension score, so that tells me that when we tell her to do something, or that when we've read a story and we want her to recall it, she can do exactly that. And I tell you, she does really, really well at remembering um, significant details, in my opinion, for a child of her age, let alone a child placed in special ed. So I can tell that you read to her a lot in this, and I can tell you ask her to do a lot, and then I can also tell that you have good discussions with her and conversations, that you're not just talking at her, you're speaking with her. That's important, and people don't realize that for this age group. It is important to have conversation. Um, I would like to continue to build her morphemic awareness, which is a big fancy school word for knowing what each letter sound says. And what we do then is we build. So we take two letters and build, and three letters and build to create words. And then we're able to look at the word act, A-C-T, and we're able to say act, act. She's developing that skill, and that's why she's borderline in one of those areas. So let's work on that together at home with you practicing her reading, and just by reading stories with her, let her read to you, you read to her. Um, and then we'll move on here to discuss the Kaufman test. So, I'm sorry, we just did that. Let's move on to discuss the ABAS test, which is the Adaptive Behavior Assessment System. Okay, so this test is about communication. It's about learning what her community, the functions are of the community, and what her role is in it. So it's a normed reference test. So when she gets a question wrong, it adjusts down. When she gets a question right, it adjusts up and gets a little more difficult. So this test is intended um, for people for ages birth to 89 years old, and the goal of the assessment is to check the skills of daily living in individuals who have delays and issues, who are autistic, who are um, non-neurotypical, who have physical impairments, and parents, you probably remember filling out this form. Parents and teachers are asked to fill out a form to give information. And in the case of some of the adults who are being tested, they too may fill out their own form. Her ability to communicate with others is of average range, and she struggles in the area of community use. For example, knowing where to go and how to get around in the community. This score means she functions at the lower level of those in the age, or in the average rather, excuse me, or proficient range. So she needs practice doing school and doing the community. For example, riding a bus. She at this point doesn't demonstrate a knowledge of how to do that. And I know that in our community, we don't have buses. Um, she rides a school bus, but she doesn't ride a community bus. And there are no taxi cabs here in our community, so she doesn't know what a taxi cab is for. Um, so those are things that are our obligation as a school and as a family to teach her. Okay. She also took the Comprehensive Receptive and Expressive Vocabulary Test Second Edition, and um, her scores present in the average range to the above average range. She has a composite score of 107, which reflect that her skills are considered to be within the average to normal range for kids of her age. Um, this particular test is normed referenced again, so that means when a problem is difficult for her, it scales it back on the next question um, to re-ask the question that she didn't get correct, to re-ask it in a way that she may make a better connection. Um, or if she got the question right, it's going to make it a little more difficult so that there's a better snapshot of how she's functioning. Okay, so we want to, with this assessment, we're identifying any discrepancies in expressive and receptive language. And she will identify and explain proficiency um, in the areas that she's doing well in. People who are thought to be delayed in their language development take this test, and it's a tool to document progress in development while students are receiving intervention supports and services, and I feel like she's doing really well. We want to continue that push for growth in that area. And finally, she took a test called the Developmental Test of Visual Motor Integration. And this assessment measures how well her visual and motor systems communicate to each other. So, what is her body telling her brain to do? And she'll see something, and her brain has to figure out what she's going to need to do to respond to that, and then get her body to actually do it. Um, her borderline and moderate descriptors are related to her deviation in functioning um, against the mean. So that means she's kind of below average. Um, she's right at the possibility of qualifying for services, but the deficit area because the deficit area did need some additional help in order for her to hold her own. Um, we're going to qualify her for services. Um, the PT, the OT, and when we had conversation that you were part of, we all agreed that that was going to be a good thing for her. Angie definitely needs the extra help to perform certain skills, but we also can see through comparing testing from last time to this time that she has made some significant gains, and we're really grateful for all of your support to get her growth on a good path. So thank you for coming in. I hope that if you have any questions, you feel comfortable enough to come and ask me for questions and to ask me questions. And if I don't have answers for you, you know that I'll find them. So thanks for coming in, and I hope you have a great day.